Okay. Hi, my name is Angela, and thank you guys for watching my presentation today. I'll be presenting on type 2 diabetes. I had a partner that, Ariana Brown, who wasn't able to come and present today, but she was a part of this presentation.
Okay.
I do want to start off by talking about what type 2 diabetes is. It is a chronic illness that causes our cells to not be able to take up glucose, which causes a problem because we use glucose as energy. So it also leads to glucose buildup in our blood, which leads to high blood pressure, which leads to, high sugar in our blood, which could end up leading to other health issues. So in healthy individuals, usually our pancreas releases a hormone called insulin, and insulin is what helps our cells uptake the glucose. So individuals with type 2 diabetes, even though their pancreas is releasing insulin, it's just not uptake, our cells just aren't using it to uptake glucose, which causes an even bigger problem because then your body thinks that it needs to release more insulin. So your pancreas begins to release more insulin, and then you end up having insulin resistance because the glucose still isn't being taken up. And again, this causes a problem because high accumulation of sugar in your blood really leads to a lot of issues in the future. Some facts about type 2 diabetes is 415 million people around the world are diagnosed with type 2 diabetes. You're more likely to get type 2 diabetes if you're from African, Asian, Latino, or Native American descent. Type 2 diabetes is also the top 10 causes of individuals dying. And also, sadly, the older you get, the more likely you are to develop type 2 diabetes. Now, how to prevent type 2 diabetes. There's two types of diabetes. Type 2 is actually the only preventable one, whereas type 1 isn't preventable. And just to give you guys an idea of what type 1 diabetes is, it is your body not being able to produce insulin, whereas type 2 diabetes, as we mentioned earlier, is our body being able to, but it ends up becoming resistant to it. So yeah. There are the ways to prevent type 2 diabetes is by exercising daily, even just 30 minutes a day, just going out for a walk, just, getting your body moving. Also eating healthy and maintaining a healthy weight, or if you're overweight, losing weight. Now the causes and symptoms of type 2 diabetes. Individuals who are who have diabetes will show increased thirst and hunger, excessive urination, fatigue, unexpected weight gain, and numbness of the finger and toes. And the reason you get excessive urination is because normally our kidney is used to filter our blood. So they see that there's an excess of sugar in our blood, so they're trying to get rid of the sugar. So our kidney ends up making more urine so it can release the sugar. So that's why we have excess urine. And again, unexpected weight gain. The reason you get symptoms like that is because there is a big accumulation of sugar in our blood, and if that's not being used as energy, it just ends up being stored as fat, sadly. The causes of type 2 diabetes are poor diet, pregnancy, smoking, age, obesity, infection, and genetics. The reason pregnancy causes type 2 diabetes, which is crazy, but the reason it causes it is because when you're pregnant, your body is releasing a lot of glucose. So to compensate for the glucose, your pancreas is releasing insulin, and it's too much, so you end up getting insulin resistance as well. So that's how type 2 diabetes gets formed. There are treatments for type 2 diabetes. Again, as mentioned earlier, change of lifestyle, exercising more, eating healthy. There are at-home testing, which is the little picture in the corner, and you can see your blood sugar levels throughout the day to make sure that you're not excessively eating sugar and your body isn't able to absorb it and leading to high blood sugar, or And there's also medication, both oral and ingestible, and these medications release glucagon, yeah, and that is used to break down glucose. So it helps, like, if there's too much sugar in your blood, then these medications will help, like, break down the sugar in the blood. Surgery is also an option, but surgery is usually the last option that, like, all physicians take because like, there's too many side effects to it. But yeah, if you have, like, if you're obese, as we mentioned earlier, and like weight loss can help with type 2 diabetes. So usually the surgeries that they take are like gastric bypass surgeries to help people lose weight. But again, too many complications, and it's not, like, always the best route to take. Yeah, that's the end of my presentation. Thank you, guys.